This is a community analysis of Dunedin, Florida, presented by Lori DeLima and Giovanna Missick. Dunedin is one of Florida's oldest towns that is south of Cedar Key. It became established in 1852, which is only 7 years after Florida had become a state. Dunedin's founding fathers were of Scottish and American heritage. Dunedin's name was petitioned into effect by two Scottish merchants, J.O. Douglas and James Somerville. Back then, Dunedin used to be Florida's primary seaport, trading center, and housed the largest fleet of sailing vessels. As the town grew into a city, it had many accomplishments, such as inventing frozen orange juice concentrate, sending the first radio signals in Pinellas County, and housing Nielsen ratings, which determines the television shows the country watches. Dunedin has evolved greatly from being known as a town of citrus growers and a great cotton field to today's bustling waterfront community.
As part of Dunedin's structure, this community provides homes, apartments, and condos to the residents of Dunedin, with the majority owning or renting, as well as accommodating for the 4% influx to the seasonal population. Those that live below the poverty level, which is below the average at about 8%, and need assistance with food, shelters, and clothing, Dunedin has provided social services and programs to meet the needs to help those families and individuals. Some of these include the RCS Grace House and Pinellas Hope. Unlike the neighboring city of St. Petersburg that has a poverty level of 17%, both the local and county services aid those in tough times. Within the school system, Dunedin has 12 private or public schools in which families can choose from, ranging from elementary to high school. Busing is provided through some of these schools based on zoning. Much like other communities surrounding Dunedin, this amount of education selections allows the parents to make the best choice for their family. Other amenities that the residents are able to enjoy are a historic downtown district for shopping and entertainment, historical museum in connection to exhibits of railroad sports and commemorations of the city's past, a community garden where you can participate in growing food for your family, and a fine arts center, as they are committed to preserving the culture and education through these facilities. Their library offers programs for children, teens, and adults with classes on computers, research, and other services that include a notary and providing books for the homebound residents. There are many denominations of worship in Dunedin to provide spiritual connection for their residents. These churches also assist in community needs by donating time and necessity for those less fortunate. This community has adequately met the needs of the residents and has provided an enriched culture, accessible education, and spirituality. Through their economic developmental plans, they have provided municipal services and housing opportunities for a healthy community. Unlike the surrounding cities, Dunedin has devoted in preserving their history, as many of their original landmarks are still there today. Dunedin has a population of over 36,000 with no great expectations of growth. Dunedin's average income base is higher than the average for the middle and upper income classes. This can be a benefit to the residents as they are more educated in the outcomes of wellness and nutrition and are more likely to be insured and thus more active in their health screening and prevention of diseases. However, populations of 65 and older are more than the average within the community. This increases the chances for disability and chronic health issues, leading to factors affecting their physical and psychological functioning. This is evident as the community's leading cause of death comes from cancer and heart disease. Another issue is the unemployment rate. Since it's higher than the average surrounding communities, this might be due to the large retirement community. Again, this will bring about prevalence of chronic illness and a shorter lifespan, leading to greater hospitalization rates. Moving on, bacterial STD is number 1 in the city for community diseases and the most common vaginal infection in women between ages of 15 and 44, according to the CDC. This is frequent with increased sexual activity in multiple partners and can lead to pelvic inflammatory disease and fertility issues. Chlamydia ranks as number 2 and has a prevalence of 110 million cases annually in the country, costing $16 billion in medical costs. Risks increase with multiple sexual partners and causes genital discomfort for both men and women, and left untreated could lead to permanent reproductive problems for the women. Dunedin's leading cause of death are cancer and heart disease. It would seem that the exposure to high-index sun rays, smoking, and an aging community leads to increases in cancer. Much like with heart disease, smoking, poor eating habits, alcohol, and age also play a part in prevalence in the city.
East Dunedin Hospital is the only hospital in Dunedin. It's a 143-bed facility that is part of the Baycare health system. All Baycare hospitals provide emergency medical care to everyone, regardless of a lack of insurance or payment method. Financial assistance is offered if an application is sent through the system, and Baycare will work with the patient to solve payment issues. As compared to Clearwater, its neighboring city that has one local hospital, once all beds are full, residents will have to be transported outside city limits to another hospital to accommodate for emergencies and acute flare-up of illness. There are 13 assisted living facilities throughout Dunedin. The cost of these assisted living facilities depend on the patient's level of care, amenities offered, and if they have long-term care insurance. Most assisted living care is private pay, and Medicare does not cover the costs. Assisted living care in the community is needed when the needs of the patient exceed the family's abilities for care or when 24/7 nursing care is needed. Dunedin has 2 walk-in clinics that house pharmacies and health supplies, a CVS Minute Clinic and a Walgreens Healthcare Clinic. Services are available for patients 18 months and older. Both clinics offer services that range from minor illnesses and injuries to screenings and vaccinations. These clinics accept most insurance plans and networks and accept out-of-pay, pocket pay, and payment plans as well. 3 Healthy People 2020 outcomes that apply to Dunedin are the C20, OA11, and HDS2. C20 relates to cancer. The outcome is to increase the proportion of persons who participate in behaviors that reduce their exposure to harmful ultraviolet irradiation and avoid sunburn. So walking around downtown, spending time at the marina, and going to the parks and beach in Dunedin increases the risk of sunburn and exposure to UV rays. The community needs to be educated better to reduce these harmful behaviors. OA11 relates to long-term services and support. The outcome is to reduce the rate of emergency department visits due to falls among older adults. Most of Dunedin is made up of older adults and many long-term care facilities where patients are not supervised 24/7. Falls are common in ERs. Typically over 5,000 out of 100,000 ER visits are due to older adult falls. HDS2 relates to heart disease and stroke. The outcome is to reduce coronary heart disease deaths. The second leading cause of death in Dunedin after cancer is heart disease. The fast food diet and vacation mindset people have leads to a sedentary lifestyle that only fuels heart disease. Environmental resources present are recreational outdoor activities to promote physical well-being, such as recreational centers, a marina, 2 acclaimed golf facilities, beautiful beaches, pools, parks, and playgrounds that incorporate needs for different age groups. These facilities' fees range in pricing from a minimal fee of $5 to free entrances. Many of these fees are then recycled back into the maintenance of community recreational amenities for the locals to enjoy year-round. Safety is provided through the efforts of the Pinellas County Sheriff. Like many other cities in Pinellas County, they do not have their own local police department. Dunedin's crime rate is considered low compared to Clearwater and is below the average in the United States. Dunedin also has 3 fire departments sprinkled through the city to effectively assist those in emergency situations. They offer programs such as hurricane preparedness and CPR training, for example. Dunedin has large public works and utility services. Most of Dunedin's expenses are in operations of their water management that include delivering fresh drinkable water, treating solid and wastewater, and recycling water back to the residents for lawn maintenance. The areas of concern are with the traffic issues during downtown events, road construction, school outflow, and seasonal tourists. As this occurs, pedestrian safety is at risk since Dunedin does not have many lanes for bikers except for on sidewalks. This discourages many to ride or walk near the streets and increases hazards to the residents. However, Dunedin is in the process of approving more lanes in the community as this problem is being addressed. The government Dunedin is made up of 4 commissioners and a mayor. The city commission can be contacted through email. There are also 34 boards and committees that serve as advisory groups that are made up of community members. The meetings and agendas are available to the public and easily viewed on desktop browsers and mobile devices. To be a part of the city government that involves boards and committees, one can just simply submit an application. Being a participant in the community and local government helps give essential input to the city commission in making decisions for the needs of the community. The budget is very well planned out. There are no major gaps or holes. A majority of the budget goes to water supply and waste disposal, which are important in keeping Dunedin clean physically and supplied with safe drinking water. Economic concern lays with the new Blue Jays Stadium being placed in Dunedin. The economic contribution versus the spending is currently being weighed by the council and its effect on the budget.
Here are some of the overall community needs of Dunedin. Number 1, while there are many retirees in this community, the proportion of those who are unemployed are high, and this can lead to poor health choices such as increased smoking and alcohol consumption. In the long run, depression and risks to disease rise as prevention measures are not usually met. Number 2, along Main Street to the downtown district, Dunedin has more unhealthy choices in restaurants such as fast food chains, high-calorie restaurants, and numerous bar food joints. while the more healthy restaurants and supermarkets are more in the outskirts of the city. Reducing healthy meal choices can lead to prevalence to obesity and increased heart disease in families and individuals, which are already at staggering numbers in the county. Number 3, as this is a big problem in Dunedin, STDs such as bacterial vaginosis and chlamydia are on the rise. Dunedin is also a popular attraction to the gay and lesbian community. The CDC has found a rise to these STDs within this population as well as with the youth. Many of the symptoms of these diseases often go undiagnosed and can affect those individuals with long-term health complications.
The number one cause of death in Dunedin is cancer. This is due to the waterfront style community where residents are constantly outside on the beach, parks, the marina, downtown shopping area, and are being constantly exposed to the sun. Better sun protection is needed in these areas, or better teaching to the waterfront community members would be beneficial as well. Smoking is another issue that was predominantly witnessed during the windshield survey. Along Main Street into the downtown area, a surplus of smokers were noted, especially around restaurants and bar areas. Smoking also contributes to cancer and ties in with cancer being the leading cause of death in Dunedin. Dunedin is filled with many bicyclists, runners, walkers, and skateboarders. However, Dunedin lacks bike lanes and proper sidewalks and has frequent fairs and events that overwhelm the small streets with parking and make issues for the pedestrian safety due to overcrowding and obstructing walkways.
On a global scale, STDs are affecting sexual and reproductive health as more than 1 million infections are acquired daily and are on the rise. This can lead to an increase in other health diseases and infertility in women. Management in areas of Europe are in prevention and control through public policy. These components consist of programs to encourage condom and barrier use, increase control in more facilities, and target specific high-risk populations. Other measures are in prevention of complications to symptoms and decreasing the spread. In the community of Dunedin, the closest health department is in the neighboring city of Clearwater, and only local clinics are the only resources in reporting and managing cases. High schools also offer student counseling and condom distribution. As a community health nurse, increasing education throughout the more prevalent areas, such as bars and local hangouts, on prevention, symptom, and reporting infections. Collaborating with local commissioners on the method of prevention and providing these methods throughout the community would be a start in controlling infections.